Why is healthcare in America so expensive? Are we a more obese people, or do we smoke too much? To find the real cause, a review of history is in order. The story of what happened in 1945. With the American engagement in World War II, there were severe labor shortages, and the U.S. government needed to attract the best workers to its own factories. It therefore passed a law limiting wages all other employers could offer. Employers, on the other hand, started offering fringe benefits like health insurance for employees to retain them. These were not wages, employers claimed. This skirted the wage controls, but more importantly, no income tax was owed on these benefits. This was really a gray area of the law. But by the end of World War II, millions of employers were paying for many more millions of their employees' health insurance without reporting it as wages. Under populist pressure in 1954, Congress officially passed a law that excluded employer-sponsored health insurance from taxation as wages. Thus was born the employer-sponsored insurance in our country. Some would claim that thus was born the system of health insurance in our country. Employees knew that if they paid for their own health care or bought insurance on their own, they would have to pay income tax on their health expenditures, incurring a tax penalty. So they lobbied employers to pay for health insurance and offer them reduced wages instead. It had a few unintended consequences, however. For one, when an insured population seeks medical care, each person is spending someone else's money. And it is easy to run out of another person's money. Healthcare costs started rising. With that rose the cost of insurance. Another problem was that with each job switch an employee made, they were forced to change their insurance. And their new health insurer would decline to cover for illnesses they had already had while employed elsewhere. The new health insurer claimed that they were pre-existing conditions and could not be insured for. Since people could not buy their own insurance policy and keep it over their lifetimes, this created the problem of pre-existing conditions. And finally, when the workers retired, they would have accumulated a lot of pre-existing conditions and were faced with the prospect of paying for their health care with their after-tax dollars again. This led to the Medicare Act of 1965. Medicare allowed workers to fund their retirement health care with pre-tax dollars that would be withheld during their working years at source by the government. This saved them from income taxes on health expenditures, but the cost of health care continued to soar. People who tried to pay for their own health care without employer-sponsored insurance were hit with a tax bill. In 2010, with the passage of the Affordable Care Act, the federal government redoubled on its policy of half a century and increased the tax penalty for not having insurance even more. Predictably, healthcare costs have skyrocketed since then. The employer-based healthcare insurance is the root cause of U.S. healthcare inflation. It is also a sacred cow in the healthcare system of our country that nobody wants to talk about. All the while, it is chewing away almost a fifth of our national income. Democrats and Republicans alike know of these facts, and the path to reform is evident in light of these facts. But no politician can stand up to the medical-industrial complex till they know that the citizenry supports real reform. They need to know that people are willing to give up their employer-based health insurance deduction for a fairer taxation. Fairer taxation does not mean more taxation, it just means fairer. At the very least, when someone wonders why healthcare in the U.S. is so expensive, you can now look them in the eye and say, because of the federal government's tax subsidy of insurance policy since 1945.